This is a story of an innovative organization with global reach that is lending their gifts and abilities to help, to teach,
anti-hemorrhagics,
and ultimately to save lives.
IMA is a small organization, and so in order not to duplicate services, in order to really be effective on the ground, what we do is we work in places that, first of all, are in very bad shape, really in crisis. And secondly, really no other aid organizations are there.
The inception of International Midwife Assistance, or IMA, occurred after author-activist Jennifer Heath returned from a trip to Afghanistan, having witnessed tremendous mother-infant mortality.
She had a strong vision of a group of predominantly women in Colorado delivering very direct aid to the women of Afghanistan. What she saw in Afghanistan was a profound need for maternal child health care.
Beginning in 2005, International Midwife Assistance trained 22 Afghan women to become midwives. They all graduated and to this day attend to pregnant women in many villages across the war-torn province of Bamiyan. Unfortunately, IMA had to leave Afghanistan due to increased violence. With its home base in Boulder, Colorado, IMA began work in northern Uganda in response to a crisis wrought by a brutal civil war. Thousands escaped with only the clothes on their backs. The Teso Safe Motherhood Project Clinic evolved to meet the needs of that community. In 2006, they hired their first midwife.
I personally go to Uganda generally twice a year, but while I'm not there, not only do we have volunteers from the United States there in other capacities, nurses, doctors, different people there to mentor, it's the staff at the clinic that really does the work day in and day out.
Along with the healthcare and maternity clinic, TSMP also provides care to formerly internally displaced people relocated in villages far from Soroti. Once a week, the staff visits one of these villages with their outreach program. There they treat women who are pregnant or have recently given birth, provide much-needed family planning, treat the sick, and they vaccinate the children.
It's one of my favorite things to do. I love vaccinating children.
People in northern Uganda are Ugandans in Uganda, so they're internally displaced people.
As former IDPs attempt to rebuild their lives, the medically trained Ugandans and volunteers from the United States, Canada, and Holland treat their patients with great compassion, dignity, and tenderness. Daily at the clinic, they help women who are pregnant, giving birth, and are recovering from childbirth. They also treat those with debilitating and life-threatening diseases such as malaria, HIV, and malnutrition. Teaching and offering family planning is also a large part of the maternity staff's routine. As word spread through the local camps and villages of the maternity and healthcare offered by TSMP, IMA's board strongly felt that our work should be documented. So board member Megan Barksdale took on the assignment and traveled to Soroti to record a first-hand account.
So today is Monday, September 27th. We got to the clinic this morning at about 8. And about 9:03, our first baby was born, a little boy. It was a difficult birth. Something about his shoulder got stuck.
And I love how you are moving both your arms nicely because I had to pull on you really hard.
The child, and maybe even the mother, would not have survived this birth if midwifery care had not been available from the Teso Safe Motherhood Project Clinic. Studies indicate that what makes childbirth safe is the presence of a skilled attendant at the delivery. IMA has created a place for these mothers to have safe deliveries. Because of your generous donations to IMA, as well as grants from the Maya Foundation and Bead for Life, a Boulder-based nonprofit, TSMP has been able to grow their vital services for Uganda's poorest. They now have a reliable vehicle dedicated to the family planning program. They have created a service where they hire Bajaj drivers to bring laboring mothers from the camps to the clinic to safely give birth.
It's getting these women in to the clinic so they can give birth in a healthy environment and not on a dirt floor.
And furthermore, because of your gifts, TSMP has enough medical supplies to meet the current needs. Because of Teso Safe Motherhood's significant impact on the community, they have outgrown the building they are currently renting. In 2010, TSMP treated over 37,000 patients, and the numbers continue to grow. The need for a larger building is of enormous import.
Right now, Teso Safe Motherhood premises have become actually smaller because we have really a big population to serve, and so we need a larger place to serve these people.
We are so grateful to you people and to those donors that give you a hand. People that could have died if this project was not helping. And that's why I thank you really very much.
We are going to crisis areas and training midwives and delivering primary medical care and treating malaria. We're delivering babies. That's what we do.
May God bless you abundantly.